Good morning everyone. Today we'll be discussing about barium examination of the small intestine. So we divide into parts. This is part 1. So normally before going to the main topic, first we'll discuss about normal small intestine, some 2-3 points. The normal small intestine, it begins in the pyrolus and ends in the ileocecal wall. It is 11 feet. So this length varies depending upon the neuromuscular tone and vascular flow. Then we should know something about the root of the mesentery. Normally the small intestine, they have a mesenteric portion. The mesenteric portion of the small intestine, this mesenteric portion of the small intestine is suspended from the retroperitoneum by root of the mesentery. This is the root of the mesentery. It extends from duodenojejunal junction to the right iliac fossa. So this root of the mesentery, it crosses the horizontal portion of the duodenum, abdominal aorta, IVC, right ureter and testicular and ovarian arteries. This root of the mesentery is short 15 centimeters. Then we'll be knowing about this is the mesentery. This part is the mesentery. This mesentery has a jejunal part and ileum part. The mesenteric small intestine is divided into jejunum and ileum. The jejunal part, it forms the 40%, ileum part forms the 60% of the mesentery. Then coming to, so what are these folds? Normally this is the small intestine. We have an outer curvilinear contour and inner contour is characterized by folds that encircle the lumen. These folds are called as vulvae conventis, plica circularis, or folds of Kirkland. So what are these folds made of? These folds are composed of mucosa and submucosa. Remember, these folds are composed of mucosa and submucosa. They increase the surface area by 300%. Normally, these folds in jejunum are thicker, taller, more numerous than ileum. So this one you remember, which may be useful to identify which is the jejunum, which is the ileum in the barium examination. So in jejunum, the folds are thicker, taller, and more numerous. And then in the barium studies, they appear as radiolucent filling defects. Then we have villi. So here you remember the folds are composed of mucosa and submucosa. The folds are composed of mucosa and submucosa. Here you can remember this is the mucosa, this is the submucosa, this is the fold. And here we have a circular and longitudinal muscle layer. Inner circular and outer longitudinal. So this is the fold made up of mucosa and submucosa. And again on the mucosa we have, in the mucosa is made up of epithelial cells. We have lamina propria and muscularis mucosae. This mucosa we have villi. This on the top we have villi. Finger-like projection. What are these villi protrusions of epithelium and lamina propria? Again, these villi are tall and thin in jejunum and short and broad in ileum. So these are the folds made up of mucosa, submucosa. Again, on the mucosa we have epithelium, villi. These villi are made up of epithelium and lamina propria. So today we have learned about folds, villi. We have learned about root of the mesentery. Meet you in the next class.